Hello everyone. Hope all is all is well with everyone. And it's Webinar Wednesday, so hope everybody is staying healthy. We're going to talk about some mommy makeovers today. Some good news that just came a few minutes ago is the fact that Governor Cuomo looks like he's opening essential surgical facilities to be able to have surgical procedures done outside of New York City, potentially in our Long Island office. It's not finalized yet. He's planning on signing that. So we have some good news as the numbers are going down, and we're looking forward to opening and making preparations for that happening hopefully mid-May. Getting to mommy makeovers. We're going to talk about mommy makeovers, surgical and non-surgical issues, and we'll go through all of that. So what is a mommy makeover? Obviously, mommy makeover is not a medical thing. Mommy makeover is just a compilation of procedures where to address the negative physical effects after pregnancy. And to a certain extent aging, but for the most part pregnancy and childbirth, including changes that happen to the breast. Whether or not there is breastfeeding, with long-standing breastfeeding actually it's a bit more, but in general breast body procedures to address those issues. So pregnancy and childbirth takes a bit of a toll on most patients' bodies. There are a few lucky ones that go unscathed, but in general, what happens with pregnancy, the breasts and breastfeeding, they lose their shape because of the fact that there is a change in breast volume, and you could go up to 2, sometimes 3 cup sizes larger, and then after that goes down, what happens is the fat element of the breast gets smaller, whereas the actual glandular tissue itself gets larger and gets smaller. And then that change actually addresses the skin elasticity and addresses and makes things a bit droopier and does not look as good as it did before. Certainly when we talk about the abdomen, that's where the brunt of the issue is. What happens is not only there is weight gain because of pregnancy, but the abdominal wall muscles separate, becoming separated, and even after you work out, you cannot bring them back together. And the only way to really bring them back together is by suturing the midline and bringing it together to make that look nicer and tighter. Now, most people would lose most of the baby weight after pregnancy, and ideally before any abdominal procedures, you should be at a level where you were before pregnancy in terms of weight. Certainly last but not certainly least, the vaginal area, you could use rejuvenation, and after childbirth, especially vaginal childbirth, there may be incontinence. There could be both vaginal laxity, overactive bladder, or sexual dysfunction afterwards that needs to be addressed for patients' quality of life. All right, we're going to start with breast and work our way down. So we're going to talk about some non-surgical things first. In general, I'm going to talk about this procedures. Anything that's non-surgical is not going to have as dramatic a result as something that's surgical. So having said that, there are some people that either have minimal effects after pregnancy or don't want to go through procedures or more invasive things, at least at the very least initially, to get some sort of a result. So I'm going to talk about tone cryoshock and thread lift, which are effectively non-surgical procedures to smooth out the wrinkles, maybe give yourself a little tiny bit of a lift. There are a few other more invasive thread lifts in the market that are going to be FDA approved hopefully by the end of this year, but actually non-surgically, you can put a thread inside to lift up the internal part of the breast. Basically something that you may notice after when you raise your arm up, you may notice that kind of a lift, and it will give you something similar to that non-surgically. And certainly there is body tight or breast tight in this sense, where it is not truly non-surgical because we actually go on the inside of the breast to deliver it, but it's not excisional surgical. In other words, we're not removing breast skin or scars on the outside to provide this treatment. And with body tight or breast tight, um, um, you actually will end up getting a tiny little incision to put the lower part of the introducer in. This is radio frequency, and on the inside of the breast will tighten the skin to be able to give it a bit of a lift. So this patient had not only tightening but also a liposuction to remove some of the fat-ish on the inside of her breast. And as you can see, not only she looks smaller and uplifted, but tighter and higher on her breast itself to be able to do that without any external scars. So in terms of surgical procedures, there are basically three overall categories of what we do. A breast lift or mastopexy is when we actually place scars around the nipple to be able to add and lift the nipple areolar complex. So when we lift up the nipple areolar complex, the shape of the breast needs to be redone and wrapped around the new position of the breast and make the breast look uplifted and better. A breast reduction is effectively a breast lift and at the same time removing breast tissue. So it's an elevation or a lift and removal of breast tissue at the same time. Whereas in a breast lift, you're only removing breast skin. In a breast reduction, we're removing breast tissue and breast skin at the same time. Now, breast augmentation is when we're adding volume. It can be done with implants. It can be done with your own fat. If it's an implant, we'll talk about it. There are different ways and different types of implants that we can use to provide augmentation or volume. And sometimes we combine breast lift and breast augmentation to provide upper pole fullness and the upper part of the breast, as well as bring a lift to the breast to make things look youthful and larger. Let's talk about a breast lift. This is a procedure that's generally done under anesthesia. You go to sleep. It's an outpatient procedure. You have it done. You go home the same day. Patients that are good candidates for this procedure are the ones that are at their ideal weight, have stopped breastfeeding for at least 3 months prior to the procedure, and they want a more uplift and youthful breast, not necessarily bigger. The idea of a breast lift, it can actually make you look a bit smaller because you're tighter on your breast body when we do a breast lift. And this definitely certainly includes scars. And these patients are typically 3 months after the procedure. As you can see, there's a scar here that we're not showing her nipple, but the scar coming down the bottom of the breast. It's called the lollipop lift, coming down to the bottom to make that uplift happen. And as you can see, we're kind of starting to see a bit of her areola here. The areola is much larger. As part of either breast lift or reduction, you actually get an areola reduction as well. And that uplift includes that reduction in areola. So the skin is removed and breast on the inside is reshaped. Occasionally, we either use a mesh on the inside or use your own breast tissue to attach it to the muscle so that you get a long-standing result from this operation. The breast reduction is effectively a breast lift with tissue removed. As you can see, especially in this patient in the lower part, she was quite a bit droopy, bigger on the right side, not so much on the left side, has a lot of skin changes because of weight loss and weight gain. And we're able to remove and reshape all of that with a scar typically going around the areola, down to the bottom of the breast and in the fold of the breast. Again, an uplift and a reduction with the removal of breast tissue. And whenever we do a breast reduction, we actually remove that breast tissue, and we always send it off for the pathologist to take a look at to make sure that they don't have any breast cancer or any abnormalities found in that type of a breast tissue, because breast tissue is sensitive tissue. We want to make sure that everything is negative. And last is breast augmentation. There are different types of breast augmentation. It always means making your breast larger and augmenting the breast. It's traditionally done with implants, whether or not being saline implants, silicone implants. We have a hybrid, which is a hybrid saline silicone, and also shaped saline implants. It can be placed through an incision in the underneath the areola, through the bottom of the breast or in the fold of the breast, or it can be placed through the axilla or the armpit or the belly button. And there are different patients that are candidates for these different insertion points, and we always take a look to customize that to each individual patient. Sometimes we even do what's called a hybrid breast augmentation, where I put an implant, for example, a saline implant through the belly button, and then the remainder for a natural look, I actually put a bit of fat around the implant for that perfect natural look. We're going to move on to the abdominal area, the area basically that takes effectively the brunt of the mommy makeover issue. So non-surgical options are quite a few. Cool sculpting is probably the #1 fat reducing leading procedure in the country. It's a non-surgical freezing of the fat that is done to address bulges. Tone cryo shock, similar to what we talked about earlier with the breast, can be done on the body, can be done on the waistline to improve remove fat or minimize fat and improve skin quality. Sulfina is a minimally invasive, it's not truly non-invasive procedure for cellulite to address cellulite in typically the thighs, the back of the thighs. And thermitite is again minimally invasive placement of a radiofrequency probe underneath the skin to provide skin tightening. We're going to talk about all those individually. This is a cool sculpting patient of ours, young patient that just didn't like this little bulge in the lower part of her abdomen, and cool sculpting was placed on the abdomen, and basically in her case was 2 treatments done approximately a little bit over an hour, completely non-surgically, squeezes the fat into the applicator, but we freeze it. We spare the skin itself, so you don't get a freezer burn, if you would, and then it basically gives you approximately 20% fat reduction in the area that we treated. A lot of times we do a combination procedure where we do the abdomen, we do the flanks to kind of get a compounding effect in the entirety of the area. Tone by Pagani or cryo T-shock does a similar thing where we, instead of sucking the fat into the applicator, we actually do a rolling combination of heat and cool to basically provide a differentiation between freezing and hot to make the fat go into what's called programmed cell death, which is similar to what happens in cool sculpting, and basically make the fat melt away and also tone the skin itself. Sulfina is to address cellulite. A lot of people after pregnancy, or certainly before, can have cellulite, and similar to this lady who had it in her area of the bum and the lateral thighs. You literally are going inside after the area has been numbed, and you release the attachments from the muscle to the skin that cause cellulite to begin with. So it doesn't remove fat, it just releases those areas. Occasionally, we'll combine this with liposuction if that's the area that needs to be addressed, or combine it with cool sculpting to address both fat and cellulite at the same time. But it's the #1 FDA approved, long-standing procedure for cellulite reduction. Thermitite is non-surgical, as in we're not going to remove skin, but to provide that kind of tightening in the lower abdominal wall or even the upper abdominal wall, and somebody who doesn't want to have an excisional surgery and overall looks good, does not have extra fat. This is mainly for skin tightening, where we place this radiofrequency probe under local anesthesia underneath the skin and provide tightening of that entire area, and has minimal downtime of swelling, and it's done under local anesthesia, not surgical. So then we're going to talk about surgical options. So the mainstay, what I do as a plastic surgeon, is surgical options, and basically a mommy makeover includes some sort of a tummy tuck or liposuction to address the abdominal area. So tummy tuck or an abdominoplasty is when we actually remove extra skin from the lower part of the abdomen, and we'll talk about the different types of tummy tuck, whether or not the mini, extended. And liposuction is where we actually go in and remove the fat cells using liposuction, and I have different modalities, either tumescent, power-assisted liposuction, or water-assisted liposuction, where there are different modalities that are used to actually remove the fat and provide sculpting. And certainly the other thing that we do that's very critical is to actually, once that you remove the fat, you want to tighten the remaining skin that you're leaving behind, and the different modalities that allow us to do that. So let's talk about abdominoplasty. I do a very particular kind of abdominoplasty called the lateral tension abdominoplasty. Both of these patients have had that. If you take a look in the lower part of the abdomen, there's a very low, fine scar that's in the bikini. Eventually, you don't see it. Effectively, what's been removed is everything below the belly button, which is the majority of the stretch marks in that area. So all of that gets removed. Then the stretch marks that you see on the top are actually not transposed all the way down here, and they're stretched, so you're not seeing them as much. At the same time, we do some liposuction to bring the waistline in, and this is somebody who is a bit heavier, and she had the lower part of the penis, and sometimes we extend that, like an extended abdominoplasty, lateral tension, to bring the scar a little further out and do some liposuction to address those areas. Most important thing within abdominoplasty is the appearance of the belly button. I have a proprietary way that I make the belly button so it looks natural when you wear a bikini and doesn't have the telltale sign of a tummy tuck, where we occasionally have to redo from other surgeons who've had an abdominoplasty. So in this area, we give a lot of attention to make that look quite perfect. Liposuction can be done without a tummy tuck, and it has to do with how much improvement you're willing to get. With an abdominoplasty, you're literally cutting out skin. So whenever you cut out the skin, you're going to get a lot more tightening than combination of liposuction with skin tightening, which is what these patients have had done. Albeit younger patients look really good after the surgery. These are done with tiny little holes in the groin, typically one inside the belly button. Go inside and contour the abdominal area, similar to this lady. Really bring the waistline in and make that area look better, all through small little incisions in the bikini area. At the same time, we do some skin tightening. And the skin tightening, similar to the last two patients that I showed, they not only will remove the fat, but also provide some etching and skin tightening. And there are different types of skin tightening that I perform, and I'll get to later on. So you want to really talk to your surgeon, or really have somebody doing this that has initially the sculpting ability to really provide these sculpting areas. It's not just about removing fat, it's about actually leaving some fat behind in the areas that you want to for sculpting, and also remove the majority in your waistline where you want to bring the contour in. And certainly tighten the skin afterwards as well. So like this lady's had it in her outer thighs, her waistline, her lower abdominal area. I did some etching, which is what she'd like to have in her side. And we actually put some of the fat that I removed in her breast to make that look better as well. Whereas this patient, we was a bit heavier to start off with. We did some contouring. She's not perfect. There's some areas that are irregular, but overall, without a scar, she looks phenomenal for having had no excisional surgery. And you actually kind of see the edges of the liposuction scars, which over time actually will continue to fade. So in terms of skin tightening, I have basically 3 modalities in the office. Body tight, which is radio frequency. We talked about the breast type before, where the element is placed underneath the skin, and it actually tightens the skin from the outside and inside. Then there's laser, the very first skin tightening available, which we still use in selected patients, that uses a laser or smart lipo to tighten the skin. And then the newest one, which is called Renuvion or J Plasma, uses helium gas to tighten the skin from the inside. So I've said all this in terms of surgery, abdominoplasty, liposuction, tummy tucks, non-surgical things. Weight loss is critical. And if you've not lost your post-baby weight, most important thing to do right before any of what we talked about is actually weight loss. There is a special diet that we offer here in the office called the Nuvo diet. I've personally lost over 40 pounds on it. It's a diet where it's a very, very low fat diet, some carbs, but low carbs. And for 40 days, you're to lose 30 pounds. It's a diet that we typically provide to patients that are having difficulty losing the weight before surgery. And I'd like to start the diet 40 days before surgery, and then immediately after the diet is stopped, do the surgery. And then the idea behind that is, as great as this diet is, the most common thing to happen after any diet is weight gain. And what I'd like to do is I want to freeze that. I want to make that look um, perfect by doing the procedures that can help lock the weight in right after surgery. So once you've maximized the weight loss with the Nuvo diet, then we'll do the surgery immediately after. Last but not least, we're going to talk about the vaginal area. So this is an area that a lot of patients don't talk about, and it's a little embarrassing to talk about it. Sometimes they talk about it with their gynecologist, but a lot of patients don't know that there is a non-surgical way to address most common things, which are dryness, irritation, sexual dysfunction, urinary dysfunction that I get from patients quite often actually, and looseness or vaginal laxity. Um, and that's Thermiva. Thermiva uses the same radio frequency that we use for FaceTite or Thermitite, where we can actually gently heat the internal vaginal wall, which actually addresses issues of tightening even better than external skin. So internal mucosa actually responds to this heat a lot better than everywhere else in the body. So doing Thermiva procedures, which is something that's done typically 3 sessions 1 month apart, even after the first patients, first session, a lot of patients show improvement and improvement in those areas, especially urinary dysfunction and laxity and dryness after this procedure. There is, so that's a non-surgical way to address vaginal looseness, whereas labioplasty is a surgical option to address the look of the labia. Now, the labia has external elements and internal elements. The labia minora is what the external element can be an issue. The biggest issue is self-esteem issues, the appearance of the area. And occasionally it actually is a functional thing, which is uncomfortable when you're working out and certainly during intercourse. So that's something that can be addressed surgically where we basically camouflage a scar on the inside and remove that extra skin of the labia minora and get that area to heal well. The mommy makeover is typically the combination of the breast, abdomen, and the vaginal issues to basically make the whole mommy over. There's some examples of our patients that we've treated over the years. This is a 32-year-old. As you can see, she's pretty fit. She's had a lot of lower abdominal skin laxity, and of course, she did not like the size of her breast. So what we did is an abdominoplasty, a lateral tension with a scar in her groin. I removed everything from her belly button down, made her belly button look a lot better. All the stretch marks are effectively gone. I was able to put saline implants through her abdominoplasty scar, so she has no breast scars. So through the tummy tuck, I was able to put those implants in, and she went from an A cup to a C cup, and she looks great and bikini ready. Next is a 33-year-old who didn't like droopy breasts, didn't like a lower part of her abdomen. We did a lateral tension abdominoplasty, made her belly button look a lot better. Her waistline is snatched in and looks really good. Her breasts are lifted and much shapelier. And also I did some tightening and liposuction of her inner thighs to make that look a lot better as well. Next patient is also a tummy tuck patient. I did lateral tension abdominoplasty on her. She had basically an outie belly button. She didn't have much of a belly button, so I had to create a new innie belly button for her. She was pretty fit. There's really no fat there, so even though I did some liposuction to bring it in, it wasn't a fat lipo, it's fat shape, and certainly she needed some volume elevation and lift of her breast, so I had an implant and a lift for her at the same time. 37-year-old, I did a tummy tuck on her, abdominoplasty, liposuction of her waistline, we did a breast lift. She had good volume to her breast. All I did is reposition the tissues that were down here, much higher up in her breast, attach them to her breast tissue to make that look a lot fuller on top. Scars will continue to fade over time. This is a 3-month picture. Nice natural belly button, well hidden scar, nice waistline, and mommy made over. 39-year-old, did an abdominoplasty, tummy tuck on her. Her breasts, she was overall happy with, but what I did is just removing some of the fat from her waistline and adding to the top of her breast makes her left breast look somewhat lifted. It's not a major change, it's a small change. She would formally need a breast lift with scars. She didn't want to go through that. So all we did is add some volume to her breasts. Next is a patient who had a mommy makeover as well. She had a lot of looseness in her lower part of the abdomen. We removed effectively everything from her belly button down, liposuction of her waistline, scars around the areola down to the bottom of the breast, nice breast lift for her. And overall, the other thing that happens in these patients is they look younger because of the fact that the abdominal wall looks flatter and they'll look better, even though I may or may not have done anything to their face. They actually appear younger. Then we get into more deeper issues with patients who've had massive weight loss or they need an extended tummy tuck. Like, for example, in this lady, I had to remove the majority of her abdominal wall to get her this kind of a result. They still have a bit of laxity here, and occasionally we have to go in and remove additional skin, but it's all about improvement and how much we can get with skin tightening non-surgically and certainly surgically with the tummy tuck. Another patient with a tummy tuck, a lateral tension abdominoplasty, liposuction of the waistline, breast lift. It's quite body and, like I said, self-esteem and face transforming. So I'd like to see if there are any questions. I know we had some questions from beforehand. Jackie, if you'd like to go through those questions that came through the webinar so we can answer them. And
sure.
Go ahead.
Yeah, thank you so much, Dr. Tehrani. That was amazing. So we did have some questions that came through that I wanted to speak on, and just kind of some general questions that I know that we get a lot of. You know, number one, and also everyone feel free to write in the comments in the chat any questions you do have so Dr. Tehrani can answer. But one of the number one questions I think that we get a lot of is, how soon after I have a baby can I have a mommy makeover?
So the two elements to that. If the main reason to wait after a pregnancy to have the mommy makeover is abdominal reason. If that's the main area, you have to wait 3 months. And the reason you want to wait 3 months, especially if you've had a C-section, is to get the C-section scar to heal well. And you don't want to have, some people say, hey, can I do a C-section and a tummy tuck the same day? Your uterus actually stays large for a good few weeks after giving birth. So you want to kind of wait that out, lose some of the baby weight, and to address that. And so as far as the breast is concerned, I want to wait at least 2 to 3 months after you've stopped breastfeeding to make sure that your breast size and basically shape is the final size, so we can talk about whether or not you need a breast lift or implants at the same time. If you do a breast lift and your breasts are larger than ideal, and then you lose some of that volume, and we didn't do an implant, we kind of didn't do a good service. And of course, you want to do this one time.
Okay. Okay, interesting. Next question. Can I have children after a mommy makeover?
Yes. So the liposuction variety of mommy makeover is something that I would recommend if somebody's still thinking about childbirth. I don't recommend the tummy tuck unless you have a dramatically loose skin until you're done with childbirth. Not to say that you can't have children. You can have children after a tummy tuck, but unfortunately you would have to redo it, and the results are not as perfect when you do it a second time or even a third time. So it's better to wait until childbirth to do a tummy tuck, but certainly liposuction or breast procedures can be done before childbirth is finished.
Okay. Another question. So I know that, during pregnancy, sometimes the abdominal walls and muscles separate. Can you just explain that a little and what you do to help fix that?
So the lower, especially the lower part of the abdomen, depending on how petite you are, how much larger you are, that effect is different. The two muscles of the abdominal wall actually separate, and no matter how much you work out, the area in between, called the fascial diastasis, does not come back together because it's not muscle. It's an area that's been stretched that's not even muscular. So not only you can't work out because you got this bulge in between, but your muscle itself starts getting weak. So the only way to fix that is to actually put sutures in it. And not only do we put sutures in it to tighten it to what it was before, I actually exaggerate that to bring the waistline in even further. So then after surgery, you have this tight area that when you work out and when you exercise, you actually start seeing the benefits of the slim tightening.
Okay, awesome. So we have some people writing in the chat. When you add implants through the tummy tuck scar, does this mean that you'll not get a lift since there aren't any scars?
So that's for somebody that, one second. That's for somebody who does not need a breast lift. The idea, if we're doing a breast lift, you already have a scar on your breast, and I'm going to put the implant through that scar. So for an augmentation patient that does not need a lift, then I can put it into the tummy tuck scar. So if you need a lift, we're going to put the implant through the lift. If you don't need a lift, is when you can benefit from doing a transabdominal or transumbilical breast augmentation, where we end up using an implant through the belly button or through the tummy tuck scar.
Okay. Next question, how big are the scars for a full tummy tuck? Is there a difference between scars when you're doing a full extended tummy tuck versus maybe a mini tummy tuck?
Right. So there is kind of a gamut of sizes of scars. The mini tummy tuck would be maybe a bit bigger than a C-section. Then hip to hip would be a lateral tension abdominoplasty. An extended tummy tuck will actually go further towards kind of the side, almost in the back of the waistline in terms of length. But the majority of what we do is the lateral tension. The mini tummy tuck is for somebody who doesn't have a tremendous amount of loose skin. And now we're doing fewer and fewer of those patients because now we have some great tightening devices. Those are the people that I used to do a mini tummy tuck on. Now I can do liposuction with skin tightening. So it's an individual thing that we have to discuss with patient A to show them how much improvement you will get with either skin tightening, liposuction combination, or B, how much they're willing to go through in terms of scar and the risks of scar versus skin tightening.
Okay. Next question. So if you do get a tummy tuck or any kind of liposuction work on your stomach, can you do bodybuilding, CrossFit, Pilates, any kind of exercise to expose the abs afterwards?
Absolutely. And now that the new foundation for the muscles being put together has been there, you can. So the scars heal and achieve 80% plus, more than 80% of what they had before, about 2 months after surgery. So I require patients not to do any strenuous or ab exercises after a tummy tuck for a good full 2 months after surgery. After which you slowly start doing ab exercises and the remainder of your exercises to basically strengthen those muscles, and it can actually start seeing abs and lower part of the abdomen, and also that there are other muscle tightening, non-surgical treatments like M-Sculpt that's available to actually give you exercise of the muscle after the surgery.
Okay, thank you. Next question. I guess these are similar. Can you have a mommy makeover at one time? Like, can you do a breast lift and a tummy tuck together? Some people are asking.
Yes, you can. So the idea is to maximize the number of procedures you can have done within safety. So the safety guidelines are from 1 hour anesthesia up to 6 hours of anesthesia. Your anesthesia risks is the same. So we minimize and basically limit the number of procedures done within 6 hours. Very commonly, a breast lift, whether or not implants, liposuction, and tummy tuck, is done about 3.5 to 4 hours. So that's way before the 6 hour mark that is within the safety guideline. Having said that, if somebody wants breast lift, BBL, arm liposuction, facelift, you want all that at the same time, that goes beyond the 6 hour safety point, and we're not going to do that in one setting. We would have to do it in 2 separate settings.
Okay. Great. Next question. So does a tummy tuck help at all with the frequent need to urinate?
Tummy tuck in and of itself does not. If anything, it might actually make that a little worse. So the idea with the tummy tuck, it strengthens your abdominal muscles. The problem with frequent urination is the fact that the pelvic wall muscles are weaker. And when you tighten the abdominal wall, you actually have a bit more pressure in the abdomen, can theoretically make that at least temporarily worse. So no, that does not help. What it does help with is actually with back pain. So because your muscles are tighter in the front, you have more core support, and people that have back issues actually gives them core support. So Thermiva is what will help with the internal tightening of those pelvic muscles that help with frequent urination and laxity.
Okay, great. So this person is actually kind of telling us a little bit about themselves. They had a question. So she said that she had a tummy tuck 3 years ago and she's pretty fit. However, the few pounds she gained, about 8 pounds, she has a little more back fat now and some back rolls. Is it possible to remove this fat and make her breasts fuller at the same time?
Yes, that is possible, and that's actually an interesting thing to talk about. There is this thing where if you have liposuction, your fat goes somewhere else, and partly that actually is true, and that has to do with if you gain weight, relatively speaking, the area that you've had procedures, either tummy tuck on or liposuction on, has fewer fat cells. It's not zero, but has fewer fat cells. So relatively speaking, her back that may not have been liposuction can have more fat cells. So that area got larger if you gain weight. So the idea is not to gain weight, but if you do, you certainly can use it to your advantage and go liposuction that area and then put the fat into the breast, face, or bum, or wherever else that it may need.
Okay, good. So 2 people asked about scars. How long until the tummy tuck scar looks his best? And also, do we have any services to eliminate scars?
Scars is what we do a lot of. So we have a very comprehensive scar program to address it. So the first 3 months, which is where we take the majority of our pictures, is when the scar starts looking really good. Scars actually continue to remodel up to 2 years. So final look, 2 years. So the idea is you don't want to wait the 2 years. And how do we kind of trying to get you to that point quicker? And that's in way of doing specific scar treatments that we have. And based on how you're healing, and we see multiple times after surgery, we'll put you on either regimen. We do microneedling of the scars, Fraxel, which is a laser treatment of the scar to make that look better. And in all of that is done in combination of either medications or scar sheets for individual cases to address those scars.
Awesome. Okay, I mean, the last really question is kind of what's the cost for all of this? Maybe like a total, like a range for a mommy makeover?
Obviously, there are multiple procedures that we have to talk about. The multiple procedures that go into a mommy makeover, either be a tummy tuck, breast, liposuction. If I had to put a number to it, it may start, we're talking something non-surgical, like cool sculpting, something in the neighborhood about $800, and could go up to $50,000 plus. So it's a big range. The best part is now with virtual or even when we're in person, we can either have you take a look at virtual consultation, so I can take a look at you and we can give you an exact proposal through the office, and or you can send pictures in for us to take a look to what we do is very visual, so to be able to give you an exact proposal for what specifically will work for each individual patient.
Awesome. Okay. Thank you so much, Dr. Tehrani. Just so everyone knows, we are offering virtual consultations. You can just head to our website, aristocratps.com, to sign up for one of those. And also, if you are interested in a consult with Dr. Tehrani, if you mention that you were here on this webinar, you'll receive $50 off your consult fee. So we hope to see you next week. We'll be talking about different skincare concerns, and we'll be sharing links through email. Thank you so much, everyone.
Thank you, everyone. Stay safe.
Stay safe.